Okay, I am Dr. Jennifer Rooke. I'm a specialist in preventive medicine, and I would like to invite you to attend the annual National Conference on the Prevention of Diabetes that's held in Atlanta every year. My area of expertise is plant-based nutrition, and my presentation will focus on plant-based nutrition and diabetes prevention. Now, again, my specialty is preventive medicine, and we all know an ounce of prevention is worth a pound of cure, but we don't really have many cures. We do signs and symptoms. Most of the medications we have today treat signs and symptoms, and we're treating signs and symptoms, but not necessarily preventing diseases. So we have to maybe go back to the drawing board and start thinking of how we can truly prevent disease from occurring initially. And we have that opportunity with diabetes, because with diabetes we have the pre-diabetes phase, wherein we can prevent disease from progressing to full-blown diabetes. Now, we don't do that because we have a lot of myths about what causes diabetes. And we address the myths rather than the true pathophysiology of what's going on with diabetes. So myth number one, eating sugar and carbohydrates cause diabetes. Pretty much everybody thinks this, and even healthcare providers I've spoken to are telling their patients not to eat starch because it causes diabetes, when in fact people around the world who eat the most starchy foods, like people in Okinawa who live on sweet potatoes, they don't get diabetes. So, well, they don't get type 2 diabetes. So eating sugar and carbohydrates is really not the cause of diabetes. In diabetes, the main problem is that the liver is churning out too much glucose, and it's not caused by sugar or carbohydrates. Carbohydrates do raise your blood sugar, but they also stimulate glucagon and other hormones that regulate your blood sugar. So eating fruit does not cause or make diabetes worse. Eating fruit actually improves blood sugar control in the long run and helps to prevent diabetes. The other major myth is that high protein diets control blood glucose. So in the short term, yes, your blood glucose does not rise as high, but in the long term, your diabetes tends to worsen if you're living on high protein ketogenic diets. So high protein diets actually worsen diabetes and increase the risk of heart attacks, strokes, and cancer. So there's a lot of studies, but some of the most interesting ones that are related to diabetes and diet are the Seventh-day Adventist studies, which found that compared to eating no meat, eating one serving of red meat a day increases the risk of diabetes by 19%. One serving of any type of meat, this includes chicken and fish, increases the risk of diabetes by 29%. Eating one serving per week of processed meats, which is salted fish, frankfurters, bacon, sausage, and for breakfast, all of these things increase the risk of diabetes by 38%. And long term, because they followed the group of Seventh-day Adventists for over 17 years. So in the long term, at least one serving of meat, of any kind of meat per week, increased the risk of diabetes by 74%. That is pretty dramatic. And there are many reasons for that I will discuss in my presentation at the conference. So we think of, well, it's just obesity, but when obesity and weight gain was controlled for in the Seventh-day Adventist studies, weekly meat intake increased the risk of diabetes by 38%. So that was regardless of weight. Okay, and I have the reference at the bottom of the slide. And so there's a lot of interesting information we now know about diabetes and really what causes insulin resistance, because we know that insulin resistance is well, one of the main mechanisms that for the increased rise in blood glucose. So again, we talked about the liver producing too much glucose, and insulin's job is to stop the liver from making glucose and also to get glucose into the cells. So insulin has two main functions in diabetes. It sends glucose into the cells and it stops the liver from churning out glucose. But insulin cannot do its work for a variety of reasons that I have on the slide and that I discuss in my presentation. So you can see some of them on the slide, and again in the presentation we go into each one in greater detail. So high fat and protein diets actually stimulate glucagon, and glucagon blocks insulin. Oxidized cholesterol in the diet kills or is the cytotoxic to beta cells, and then you have less beta cells and they produce less insulin. We'll talk about what oxidized cholesterol is in the presentation also. Obesity and fat in the muscles, which is the one we always talk about. Everybody knows about fat obesity. If you lose weight, you'll improve your glucose control, but that is not always true. I have patients who have eaten, let's say, fish every day for people who are eating fish every day for for 3 months, and yeah, they've lost some weight, but sometimes their diabetes actually gets worse because of that, especially salmon. So I have one patient who was eating lots of salmon every day, and her diabetes actually got worse. And so that's not what we expect, but that is what you see among patients, and we have to sort of address that, because when she came off the salmon and she went on a plant-based diet, her diabetes improved, and diabetes was reversed, and her blood sugar was controlled. So also cortisol blocks insulin, and we get cortisol from stress and fear, but we also get it from eating animal products, because before animals die, they secrete lots of cortisol. So there's a lot of information about the underlying causes of insulin resistance that we will discuss in the presentation. And so you can learn more about preventing type 2 diabetes with a plant-based diet at the National Conference on the Prevention of Diabetes.